and welcome to Cover Story. Today we're going to be talking about something very important, the dangers of self-medication. Ever since COVID or maybe even earlier, we've seen people, who's going to go meet a doctor, who's going to get that appointment, and everybody is a doctor, everybody has a solution, antibiotics, so everybody pops like it's, sweets or something. But now there are more dangerous drugs on the market, even something as basic as vitamin D, if taken in the wrong quantity, can be very harmful and actually send you to the ICU. We have a new drug called Ozempic, or rather an old one, but that's now being used as a wonder weight loss medicine. A lot of people are taking Ozempic injections. It is still too early to know, but doctors are voicing a note of caution, asking us that, be careful and never take that without, a doctor's prescription. So we're going to be discussing that today. I have with me a panel of experts. I have Dr. Romel Tikku. He is a director internal medicine at Max, and Dr. Anjali Huda. She practices internal medicine and obesity medicine. Good to have you both on the show. And Anjali, you had written about Ozempic. I remember seeing your post, and that's when I reached out to you. So let's
Yes,
talk about this drug of the moment. So and you were voicing a note of caution.
yes. Yeah, I think you've said it that this is something that patients are taking without supervision as well. And just because, we in India, we don't have Ozempic in the market. And that's very, that itself is a word of caution out there, and a
But
lot of,
still, people are taking it. I've met people who've lost 7 kgs with
yeah,
Ozempic.
people are
So what are they
taking,
taking?
no, they're bringing it usually from abroad.
Okay.
It's being brought from abroad and people are taking it. So, as you know, let me tell you a little bit about this drug. This is a GLP-1 agonist, and it basically suppresses appetite as well as improves the insulin sensitivity of your body. So, basically, the weight loss became such a good byproduct of correcting diabetes that it started getting used as more of a weight loss drug rather than being used only as a anti-diabetic drug. So when people go and take it, some of them are not even diabetic. That's a
Most of
very
them,
big
I
issue.
think.
Yeah. So they are taking it solely for the purpose of weight loss, and it's very clearly documented by the US FDA that this is only indicated in patients who are obese and have diabetes. There are other drugs like Wegovy are for weight management, but this is not. Although they are same salt as semaglutide, but still the FDA regulations are different.
Dr. Dikko, any your views on Ozempic to your patients and other, let's talk about first about weight loss drugs because those are really the most misused.
Well, as of now, Ozempic is supposed to be the wonder drug for weight loss, as Dr. Anjali rightfully said. But mind you, it's not, as she said, approved by US FDA for weight loss, Ozempic. Their other brand, Wegovy, is meant for weight loss, again in a higher dose under medical supervision. So we associate this drug more with vanity now rather than as a critical drug for diabetes. See, having said that, it's a wonder drug for diabetes and for diabetic patients who are obese, but you have to take it in the right dose for the right duration. You should know the side effects under medical supervision. You can't get it from abroad and do it on your own. You can't buy it from the gray market. That's not how it is done. It's unfortunately it's become popular as a weight loss drug even abroad. People have insurance in US and they're taking it, and they had to actually, the company had to increase the production. They had to work 24/7 because there was huge demand for it. And so many celebrities also take it. That's why people in India are also wanting to know about it. They're waiting for it to hit the market. There are young girls who come to my OPD every other day asking for it. They don't know what are the repercussions. They don't know what's happening. It has side effects, as all drugs. The mild side effects are gastric, mostly nausea, vomiting, diarrhea, constipation. It can give you flu-like illness,
Yeah.
dizziness, headache. But it comes with a black box warning that people who have medullary carcinoma of the thyroid, thyroid cancer, or a family history of that, they should not take it. Or if you have an endocrine condition like multiple endocrine neoplasia syndrome too, then you should not be taking it. Apart from that, it can give you severe complications or side effects like pancreatitis, hypoglycemia. Patients who have diabetic retinopathy, it can worsen. It can lead to paralytic ileus because of gastric emptying. It can cause intestinal obstruction and loads of other illnesses,
Yeah.
which in future we'll know more about it. Since, see, long-term consequences, we need more data.
Yeah.
But
Hmm.
as of now, these side effects also happen to certain section. They're not that common. Again, with the mild side effects, you get used to them. So that's why you start in a lower dose. So having said that, it's a great drug, but it's not meant for everybody. Only if you have to go, option for you is bariatric surgery. It gives you an option. If your BMI is more than 30, or the indication is if you're overweight, if your BMI is more than 27, or you have other comorbidities associated with weight gain, such as diabetes, hypertension, or high cholesterol, then it's meant for you. And I'm sure it will soon be available in India, but it has to be given for the right indication by a medical doctor, and then only it can work for you. Otherwise, it can lead to complications.
Anjali, you're also a nutritionist. You also, what are the other medicines you see people misusing in for weight loss? And also you wrote something about how Ozempic's impact on muscle mass.
Yeah.
To
Yeah.
add to what Dr. Tikku's highlighted.
So for weight loss, I wouldn't say misuse. Metformin is usually being used a lot, thinking it will
What?
cause weight loss. And it basically just again improves insulin sensitivity. That's it. Doesn't affect the appetite. But there are no other weight loss drugs in the market in India, and we are unfortunate. We should have had them. And just because Ozempic has now hit the global market such a big way, that it's coming to India. Otherwise, Mounjaro as well. But other weight loss drugs we never got. And so nobody really knows about them and nobody's using them. So only if you can, there are combinations of drugs you can use for weight loss, like topiramate and stuff. So you can do that. But even I don't use many medications. I feel food is the best way to deal with, these things. Lifestyle change, food intake. Just be
Is the
smart about
best.
eating. Yeah. And as for muscle mass, you asked me, patients are losing a lot of muscle mass when they're on this medication. So, because appetite goes away, but what they choose to eat during that eating window, they're choosing the wrong things, right? They will still
Right.
have, okay, they will not have two puri, but they will still have the puri. You know what I mean? So it's not,
Correct.
they're not going for protein per se. They're like, okay, we're not that hungry, but we'll use the same food, but we'll use it in less quantity, which is fine for the time being, you lose the weight, but it'll come right back because you can't be on it for the rest of your life. So it'll come right back. So people don't
Yeah.
understand that muscles is your backup. It's like a metabolic backup. So if you're not going to do muscle training, not eat enough proteins, this drug is known to cause muscle loss, or any other weight loss method which does not involve a good diet will cause muscle loss. And that's why people keep gaining and losing, that yo-yo phenomena keeps coming in.
I think we all suffer from that. But Dr. Tikku, I also read in one of your regular columns dangers of vitamin D, which is another reason why I'm having this show. Because vitamin D, we all deficient of it. Then we all get injections or doctors कहते हैं हर हफ्ते लो, and then we forget the doctor and we keep taking it हर हफ्ते. So
Yeah.
you said this could lead you to the ICU. I was quite zapped when I read your piece.
I've had a couple of patients in the past who were admitted to the ICU in my hospital because they were given weekly shots of vitamin D, which is not meant for every patient. There's a certain section of patients who are given injectable vitamin D, and it's
Yeah.
a once a year shot. It's an annual shot meant for people who have gastric surgeries or intestinal surgeries, absorption defects, or bedridden patients or osteoporotic patients. It's not meant for the general population. But over here, he was given weekly shots, high dose, 6 lakh units for like 6 weeks, which led to hypercalcemia, high calcium levels, in turn leading to kidney failure, kidney stones. And he was in a bad shape. And he had to be admitted in the ICU. And then we've had a couple of patients again over the years where they didn't land up in the ICU, but they had complications. They had high calcium, high creatinine. Now, vitamin D, as you know, globally, people are deficient, almost 80% of the population, because you're not exposed to the sun, especially in big cities. So what you're supposed to do is to take, under medical supervision, those weekly oral medicines, which come as small 5 ml bottles or as capsules or tablets. So you have to take them for a brief period, for 8 weeks or maybe maximum 12 weeks. And then as a maintenance, we usually ask them to take it on a monthly basis, once a month. But what people don't realize, patients don't realize, is that they keep taking it every week for 6 months, for a year, because they're lost to follow up. And they end up with very high toxic levels of vitamin D. So that is an issue. First of all, the message should go loud and clear. Injectable vitamin D is not meant for every patient.
Yeah.
Even with oral supplements, it has to be given for a brief while. You can't be on it endlessly. And apart from vitamin D, there are other supplements which people are buying online and even with pharmacies giving them without medical supervision. And then the side effects of self medication, which in itself is a risk for huge complications health related. You know, a lot of people have this habit of popping in painkillers, especially if you have fever and this is the dengue season, you're in for trouble. Apart from that, if you have kidney issues or if you have other health related issues, then these painkillers can be a problem for you. Antibiotic abuse, as you rightfully said, a lot of people,
Lot.
lot of patients who come to me in the OPD have already had a course of Augmentin, azithromycin, and they are very proud of it. They tell me, we've already had a couple of courses. We would do it with Augmentin, nothing happened. And they don't realize that most of the flu-like illnesses are basically viruses, and antibiotics are meant for bacterial infections. So we are at a loss. I keep telling them that don't do this. Don't abuse antibiotics. What everyone else is doing, it not only damages their health, but it leads to antibiotic resistance. What happens in turn is over a period of time, you need higher antibiotics, higher dose. It's a vicious cycle. And that's why we have superbugs all over. And India is unfortunately known for these superbugs now because of this. And there has to be some sort of regulation as far as, because antibiotics are available over the counter in India, it's a huge problem. Huge problem, because if it's not available, nobody's would be able to buy it. Apart from that, protein supplements, then there are Ayurvedic.
That's
Ayurvedic.
So protein supplements, see, if I talk about protein supplements, again, under medical supervision, right dose, right duration, they'll actually help you in building your body, which might be useful for certain professionals like bodybuilders, film stars, because they need to have a good physique. But if you do it because your trainer has told you, and because you're taking it not under medical supervision, higher dose, higher duration, then you can have problems. But by itself, these protein supplements don't cause kidney disease, liver disease. But if you already have a kidney disease, that can be a problem. Now, talking about Ayurvedic medicines, you have a lot of people. See, I'm a big fan of Ayurveda. And I definitely feel there has to be an amalgamation of both allopathy and Ayurveda. It will be a boon for patients. But a lot of people out there who practice Ayurveda are not qualified. And then they give you those medicines, loose medicines in powder form, which might be having metals, which might be having steroids. And that also leads, we've had over the years many patients admitted with kidney issues, liver issues, because they were on Ayurvedic medicine, especially these loose medicines, not the branded ones.
Okay.
So there are lots of these issues which people need to understand. Self-medication can really lead. The message over here is loud and clear that please don't indulge in self-medication. Always run it through your doctor. For an occasional headache or a bout of fever, take a paracetamol, that's fine. But beyond a day or two, always run it through your doctor. And don't go by misinformation on social media, especially related to antibiotics, weight loss. And as Anjali rightfully said, there's nothing like diet and exercise for weight loss. Diet, I would say, is 80%. 20% is the exercise.
Anjali, I saw you nodding very vehemently on Ayurvedic misuse.
No, I am telling you that Dr. Tikku is right on point with everything. Like whatever he's saying is exactly how I wish there was more doctors like us voicing this, and more journalists like you bringing it to that platform and
Well, we
making
should
it
do more
like,
shows, both of you.
yeah, we should do, because there's so much of abuse of self-medication is going on and on in India. America, you can try to get one antibiotic you can't get without prescription. And here, there's quickly they bypassing the doctor, and they're just going to the pharmacy and buying. So this is wrong. This is a precedence to be set by the government. This is not something you, I, and Dr. Tikku can do, because we can just make people like we can caution them, but can't do. Yeah. Acha, dusra, yeah, you were asking me about the Ayurvedic. Yeah, like Dr. Tikku said, I think Ayurveda is a great science, but Ayurveda never came in a bottle. Yeah, Ayurveda is a way of life, just like yoga is a way of life. So when we talk about Ayurveda, it has to be 80% food only. It cannot be okay, I'm going to take this supplement, and even if they're branded supplements for Ayurveda, I still feel that there is not enough checking done. I just feel, because I've seen patients suffering. I've seen patients coming up with even Hashimoto's done by these supplements. So these things are really have to be regulated. But even if they're not regulated, people who are listening to this, they should be actually running it by their physician. They should actually go do a credential check of the doctor who's given this Ayurvedic medicine.
But it's
You know,
all word of
sometimes.
mouth now. Mostly homeopaths and Ayurvedics are doctors are word of mouth.
No, no,
I'm
they
gonna.
are. But what one tried to say is that when you go to a Ayurvedic doctor, you know, just like Dr. Dikku said, pudiya mein in a powder, you can't do that. You know,
Yeah,
it has to be a well labeled capsule.
brand it.
Yeah, or
Yeah.
a powder, but it has to be labeled. It has to know, we have to know its ingredients, and they should be transparently written on the back of the bottle, you know.
Okay.
Yeah.
I'm going to take a break and come back and keep the conversation going. So stay with us. Hello and welcome back to a cover story conversation. We are here discussing the dangers of self-medication, dangers of over-medication, dangers of the wrong kind of medication. Dr. Tiku, apart from that, I think the main thing we all घूम फिर के weight loss पे आते हैं. That's one of the main problems that everybody wants to take. A lot of people now take laxatives thinking that will help, weight loss.
Yeah.
There are a lot of solutions that you must be encountering, strange solutions, which you want to caution us against.
Yeah, a lot of people get into these. There are certain supplements which are promoted on social media, but honestly speaking, nothing works for weight loss. Most of the medicines I've seen over the years, as Anjali said, that we don't have too many medicines, but the ones, Orlistat and other drugs, they have too many side effects. They don't
Yeah.
really work. I've used
Mm.
them in the past. They don't really work.
Hmm.
That's one of the reasons
Yeah.
why Ozempic has become so popular, because it's one of the drugs which really causes weight loss. And apart from that,
Mm.
there's loads of misinformation, as I said. So people do all sorts of things, intermittent fasting and stuff like that, which I would say intermittent fasting is still a healthy way of losing weight. But keto diet and all other, I've had one colleague who was on keto diet, landed with a lot of complications. So all
Yeah.
these things have to be, even this paleo diet, keto diet, has to be done under medical supervision. But all said and done, I think nothing works like diet. And you need to know the broad things, which I'm sure Dr. Anjali must be telling her patients every other day: more of fiber, less of fat, less of carbs, increase the veggies, increase the greens, increase the fruits, don't eat
Hmm.
after 7, and during the daytime, eat frequent small meals. Don't eat out every other day. We are in the habit of ordering food from outside now with all these
Yes.
apps and stuff like that.
Mm.
So, with the teenagers, especially, and with children, ordering food from outside every other day, this is
I read
leading
your
to
column on
basically.
that. Yes, very good.
So we that's what is leading to obesity, especially in the younger generation. They need to learn how to eat healthy,
Yeah.
and there is no other way to take care of excess weight. If you're obese, you need to take care of your diet. You need to exercise. Exercise is very important. But I think if you're exercising, then not eating the right kind of food, it doesn't work for you. And with our kind of lifestyles in big cities, there's so many issues work related. Otherwise, you don't get enough sleep. You're stressed. Your boss is sort of not happy with you and stuff like that. So one has to really work on the diet, and it's difficult. See, weight loss is not easy. It's a very tough journey, and
Hmm.
you really need somebody to guide you through it. Apart from doctors, you need nutritionists. So Anjali is both. So I would highly recommend people to consult someone like her who knows medicine also. She's not just a nutritionist. She knows more about medicine. She knows about nutrition. So that combination really works. So you need to know what you are telling your patients, what really diet means. What do you mean when you say low fat, low carb, high fiber? What does all that mean? So
Yeah.
I would advise stay away from misinformation. Consult proper professionals who actually help patients lose weight, qualified people who've been doing it. Go on social media and see those reels, whatever these doctors have put up, qualified people have put up, instead of going haywire and listening to all and sundry.
But Nandi, I can't have you here not ask you then what works. This is also the holiday season, so everybody is going into binging and eating. Dr. Tiku said intermittent dieting, perhaps he was, okay, in
Yeah.
favor of that. But what
Yeah.
would you say?
I think intermittent fasting is a very easy way to do it. It's just, there's no brainer. You just have to eat in a specific window of the day. But having said that, sometimes it also backfires for some people because there are people who are overweight, they're skinny fat.
Hmm.
When they're overweight and they don't have any other chemical abnormalities in their blood work, then it backfires, because then they don't lose the weight, or they lose muscle, things like that happen. They don't. So best way, I think, what works even in holiday season is to just have a simple eating plan. Just have like 2 meals a day, one snack. I think eating a lot is just putting yourself through so much of metabolic burden. I think just having some like healthy, maybe vegetables. Vegetables are so good and so less in calorie. People don't eat enough veggies, I feel. And even if you cook it in the Indian style, I mean, they're fantastic to eat.
Mm.
Veggies and low glycemic food, fruits, and having too much starches from grains is just even if you want to binge on a holiday and drink and all that,
Mm.
fiber is still a most important thing in your diet.
Okay.
None of us really consume 20-30 grams of fiber per day, actually, if you see. Because if you do consume fiber, and if you eat a piece of bread, you actually negate the effect, So you have to consume enough fiber, and don't eat, don't
Mean,
drink.
don't
Don't drink
don't
so much.
mix, don't drink so much. Okay, have a sober Christmas and New Year. But
Not so much. I would say, okay, you can have your
uh,
eggnogs and whatever you have to, like, but I'm saying just drinking too much, because with drinking comes eating also, no? The
yeah.
inhibitions go down, so like that.
But another thing I heard of, maybe it's been around for a while, Dr. Tikku, but I just, is the hormone replacement therapy. A lot of people are now talking about HRTs, and they're saying it's good, it helps you sleep better, it reverses your metabolic issues, sorry, menopausal issues. Is that something you would recommend? What is it?
Not really. It's not really recommended now. It was in the past, but it has
Yeah.
its share of side effects and can lead to strokes and stuff like that. So it's not highly recommended now, even for postmenopausal women. There's a certain section of patients who need it,
Yeah.
but not everyone needs hormone replacement therapy. Again, this is misinformation, word of mouth, because someone took it, so
Yeah.
everyone else is taking it. So I wouldn't advocate it. But having said that, maybe some people really need it, so they should talk to their gynecologist. They're the ones who sort of prescribe these drugs. But as you were talking to Anjali, I was also thinking about food intolerance, which is like so common, and
Mm.
so many people have food intolerance. And the weight gain that we were talking about, excess weight, has a lot to do with what you are eating. It might not just be the quantity, or it might not be just because you're eating a certain food. A lot of people are intolerant to wheat. A lot of people are intolerant to milk, dairy products, nuts, and seafood, and so on and so forth. So they also can lose weight if they avoid that food which they are intolerant to.
So are there some tests? How do I know what I'm intolerant to?
There is a test. There's a blood test, food intolerance test. But again, somebody really needs to interpret it for you, like someone who's qualified. Like Dr. Anjali must be seeing loads of patients every day. So what to
Yeah.
avoid, what not to avoid, what happens if you're intolerant to dairy and if you keep consuming it, and what is gluten intolerance, what is celiac disease. People need to be aware of it, because there's a lot said and written about wheat intolerance and
Yeah.
gluten intolerance and dairy products and nuts and things like that. So they also, if you avoid, I have seen with my practical experience in the OPD, whenever I have advised people to stop having, based on their reports, having dairy products, wheat, eggs, nuts, they really lost weight. And without doing too many changes otherwise, they just have to stop having it for 3 months. And there's something called leaky gut, and that also heals, your gut heals.
Mm.
And over a period of time, once in a while, when you indulge, you can have these. Like a lot of people have problems with bakery products. So diet has a lot to do with it, whatever it is, whether it's weight or whether it's other illnesses. So diet is very important, I would say.
It's all in your gut at the end of the
Yeah,
day.
yeah, everything.
Totally. Totally.
So, Anjali, about the gut, what, you said fibers, of course, but, as a parting shot, everybody says, कि सुबह सुबह क्या लेना? Everybody either says have honey or have warm water, have lime something. What would you recommend?
See, there is no one size that fits all here, Some people, if you're diabetic, you're not going to start having honey and lemon water. It's stupidity to have it. So,
Right.
so I think people are doing the rubbish things in the night and wanting to like reverse it in the
In the
morning.
mix.
So yeah, you see, you can never outrun a bad diet. That is for sure. But yeah, you can do some things that maybe you go off grains that day, maybe you fast longer, maybe you just hydrate through the day with water, or maybe some very diluted fruit juices, something like that, which is easy. Body has got its own capability of detoxing. So you can just give the rest to your gut. That is the most important thing. Every time you're
Sure.
eating, you're just giving your gut like one marathon. The gut is
Okay.
churning food and trying to digest. Your liver is under pressure. So yeah, if you can just go off food, I think that's the best way to detox. There's no need to have lemon waters and methi water and all. Nothing works.
Moderation. So at the end, Dr. Tiku, which is the season you most, keeps you most busy? Is it the winter? Is it the summer? Is it?
It's usually the dengue season, but fortunately, we haven't had too many dengue patients this season.
Knock
Now,
on
the
wood.
winter season and this pollution, this is a double
Pollution,
whammy,
yeah.
double whammy. So, a lot of patients coming with respiratory symptoms, blocked nose, throat issues, and wheezing. I've seen quite a few in the last month or so, ever since the pollution levels have spiked up. So, fortunately, now it's better, but now it's the winter, and we'll be having a lot of flu-like illnesses, pneumonias, and I mean, we are busy throughout the year. Now, there's nothing like season. Earlier, people would go to Goa during winter. Now it's all the year through. Same with doctors. Something keeps you busy all the time.
Yeah.
Well, on that note, I wish you both get some time to enjoy the holidays and the holiday season also. But thank you for this
Thank
very,
you.
very
Thank
important
you.
conversation. Thank you.
Thank you, Priya. Looking for
Thanks.
more. Okay.
Thank you.
Bye.
Thanks.
For more such videos, subscribe to the NewsX YouTube channel, hit the bell icon.